Hello and welcome to the third and final session of our Peer Learning Forum, Why is Sexual and Domestic Violence Prevention Central to Population Health? This is Ashley Meyer with PreventConnect. Today I'm calling in from a conference in DC. So for those of you who are used to having to listen to me talk about Pacific time, today I am on Eastern time. So it's 2 p.m. here and this session is being recorded. As you know, PreventConnect is an online community of practice for the prevention of sexual, domestic, dating, and related forms of violence. And you all, I see you all here. I want to thank you for your participation in our many ways to communicate and be part of a prevention community of practice. As many of you, oh, look at me trying to circle the social media, do participate in our Twitter, our Facebook, on our website, you comment on our blogs, you take our e-learning courses, and many, many more things, including what we're doing today, our Peer Learning Forum. So I want to thank you all for joining us. And for the few of you who shared what you had for lunch or plan to have for lunch, I see Matt, you know, the classic peanut butter and jelly. I had a salad. Sierra also had a salad. Thank you for sharing that as well. Please do feel free to share. I think we've all come to know each other at this point, but we really enjoy your participation in our text chatting. Remember that you can do private chats as well if you'd like to talk to someone, you know, one-on-one rather than in the public chat. That's an option. You can also raise your hand for attention. We really are hoping to have a lot of. Oh, and you know what? I'm hearing background noise. So if everyone could go ahead and just mute your phones, I would appreciate that. I am hearing a lot of background noise. You can press *6 to mute your phone. We'll see if that'll go away. Oh, sounds like it went away. So *6 does mute your phones. You can also just use, it will unmute it as well. And you can also use your mute buttons on your phone as well. We're really hoping that you'll be willing to take yourself off of mute today and communicate with us. PowerPoint slides are where they always are. So there should be a tab on just about in the middle, a little bit to the left of your screen that says today's slides. If for any reason they go away, usually it just means you need to click on that tab again. We are very thankful to our partners at Aberdeen Captioning for providing closed captioning. Done a fabulous job and continue to do so, and we thank you very much for that. If you are having any issues, please call iLink Technical Support at 800-799-4510. And PreventConnect is a national project of the California Coalition Against Sexual Assault, sponsored by the U.S. Centers for Disease Control and Prevention. The views and information provided in this web conference do not necessarily represent the official views of the U.S. government, CDC, or CalCASA. And you all know PreventConnect. You know that we really focus on prevention. We want to look at violence across the lifespan. We really want to connect to multiple forms of violence and oppression. And really what we're here to do today is to connect to each other. So as you know, at this point, the third and final of our 3 sessions of this Peer Learning Forum on population health, we really, really enjoy that communication and connection that we get here, sharing those resources, sharing our opinions, our experiences, our examples, and we expect and hope that we'll be continuing that here today. So I want to go ahead and bring in Lisa Parks. Lisa, hello from, well, I'm saying hello from DC right now, and Lisa's here with us from Prevention Institute. Hi, Lisa.
Hi, good morning. Can you hear me?
I can, and you sound great.
Oh, good.
Awesome.
Oh, good.
Okay.
We're trying out these fancy headsets, so I'm hoping the sound quality will be better. Pardon
Absolutely.
me in advance if it's a little awkward, but going to do our best here.
Yes, I think you sound great, so thank you for that new technology for the benefit of all of us. Lisa, today we're continuing on in our objectives. We are especially going to continue looking at this tool, the collaboration multiplier, and what else are we going to do today?
We have lots of guests who are going to speak, many guests. We have lots of text chats. We are going to touch on all of these, but focus primarily on the second 2.
Great. Okay. Well, let's go ahead then. Lisa, I I brought you in early before the slide that's about you, but Lisa was introduced, I think kind of reintroduced. Lisa's been in the movement for quite a while, and I'm sure several of you have worked with her in the past as a part of the partnership, the California Partnership to End Domestic Violence. She's with Prevention Institute now and joining us to be a part of our web conferences once again, and particularly our peer learning forums now. Well, so welcome again, Lisa.
Thank you.
And I think I'll hand it over to you to introduce the Webtechs for the day.
Great. Well, I'm so grateful, as always, to Casey and Alexis, who are really running the show here. Thank you both. And we're going to start with a text chat question to get you all involved. I know that not all of you were on the second peer learning forum that took place on June 4th, but if you were, I would love for you to think back to that experience and chat about one takeaway, something that really stayed with you, that caused you to think or to draw out some implications for your work. And if you weren't on the June 4th web forum, then what are you excited to explore today? What are you hoping to get out of it? So take a minute to go ahead and share your thoughts about that.
Right, or if you listen to the recording, watch the recording, what did you really notice from that? So Sarah said the collaboration multiplier tool is very interesting to look through afterwards, so that's great, and we'll get into that more today. And so the rest of you, and feel free to take yourself off of mute and just speak up as well if you'd like to. It looks like Cynthia is saying that I enjoyed reading about participants' excitement about health equity work that is going on across the country and across our sites. And that's something I really noticed, is learning about all the different sites and all the health equity work that really is going on. I was somewhat surprised to see so much of it in practice.
Yeah, it was so exciting. I jotted down 5 or 6 people that I want to have follow-up conversations with, because this work is so much about pushing the envelope and trying new things. And if you've had an idea like, oh, I would love to do work in this way, or with this kind of a lens, and then you hear about someone who's doing it, and it really is. It just gives me that juice and excitement, and so inspiring.
Yes. Well, what about what folks are excited to explore today? I would love to hear some of that. So you can, if you're on mute, you can go ahead and unmute yourself. If you've used *6 to mute yourself, you can press it again to unmute yourself. What are you all excited to explore today? I know I'm really excited to get more into the tools and the tips for kind of integrating this population health approach.
And while folks are text chatting, I'm going to go ahead and do a little bit of a recap of where we've been, so that might stimulate folks' interest and excitement as well. So just to recap what we did on the first and second forums, we looked at what we called 4 bridges, and here they are. And this forum, as Ashley mentioned, and as you know, is really about why sexual and domestic violence prevention is central to population health. And so it's really been about making connections and building bridges. And so we explored these 4 bridges or connectors in our first forum. And a theme that really struck me that came out of that forum was the different language and framing of these different bridges and how they engage different partners and different audiences in different ways for different purposes. And another takeaway was the need to connect personal experience to the community and societal factors when we're using these frameworks that really emphasize those broader levels. So in the second forum, we explored opportunities, challenges, and solutions for advancing sexual and domestic violence through a public health approach. We kind of explored that some more, and we drilled down more specifically into a health equity approach, as has been mentioned on the text chat, and the potential for a multi-issue, multi-sector agenda and to be a part of something like that. So a theme that came out of that, I think especially in the rich text chat, was the need to find the win-win in multi-sector or multi-issue partnerships. And how do you ensure, this reciprocity when you're working on multiple issues and across multiple sectors? So that was really rich and ripe, and so that's something that we're going to explore further today. And of course, there's been amazing sharing of articles and projects and other resources, and I think we mentioned we're compiling those and are going to be sharing them out with you at the end of the series. So today we're going to talk more about collaboration. We're going to talk about the Collaboration Multiplier tool, give examples of how it's been used. We'll have another fishbowl, lots of text chat, and we're going to bring it home at the end by giving you time to synthesize the series and to make concrete next steps. So let's dive into talking about collaboration. Here's a quote from Houston Department of Public Works and Engineering. This is somebody who we talked to in our development of the Collaboration Multiplier Resource Guide. In order to be successful, we have to approach things from a holistic perspective. The level of talent and the diversity of organizations, that mix is the greatest thing we have going for us. So I think it really speaks to what we've been talking about here in terms of working holistically at the intersections and the strength that can come from collaboration. So we want you to chat and get on the phone. Why collaborate? Let's think about what are the advantages of working together. Let's get it out all on the table because we're going to start talking about why it's hard and what are all the barriers. So let's ground ourselves in why this is so important. So go ahead and chat some thoughts that come to mind, and if you'd like, go ahead and unmute yourself and speak up by phone. We'd love to hear your voice. We'll give you a couple seconds to do that. And I do hear typing. Jessica says, you simply cannot do it alone. Well,
absolutely. Yeah, and I'm sorry, I just do want to ask to remind people to please go ahead and mute your lines. You can press *6 if you don't have a mute button on your phone. We are hearing some typing in the background, so it'd be nice to mute your phone. Thank you.
Yeah, got to get really friendly with that mute button because we want you to mute it and then we want you to unmute it when you're ready to talk.
But turning back to the text chat, well, Jessica, I do love, we simply can't do it alone, and I think that's a fact that we see. Whenever we do community assessments, we look at our strengths in our community, the needs in the community, we see that it's at multiple levels, and that if we're not working across those levels, then how are we really going to achieve what we're hoping to achieve? It looks like there's lots of echoing of that. We can't do it by ourselves. Let's see. No individual agencies have the time or the resources to reach these huge goals solo. Lisa, I think, just some of those practicalities of our organizational capacity are very good reasons for why to collaborate.
Yeah. I see a humility here in sort of acknowledging, strengths that we bring as well as weaknesses or, areas where we're not as strong, and I think there's a nice humility to say this is complex, and we're not going to go out there and just reorder society as we see fit. That's not possible nor desirable.
Right.
We bring a lot of strengths, and we need others as well. So this is great. So Ashley, if you could keep scanning that and bring that into the conversation, I'm just going to share a little bit here, some bullet points that we put together that build on what's being discussed. The capacity issues have been mentioned, the resources, the credibility, specifically we can get more credibility and influence and advocacy power, sustainability, etc. What else are we seeing?
Solidarity. Yeah, I really like what Deborah says about building community support and connectedness. Coordination of resources, again, it's kind of at that really practical level. It's about resources and also protective factors. In connecting the dots, we really saw that protective factors go across different types of violence.
Colleen says the social problems we are working to prevent cross multiple systems across our lifespan. So I just wanted to bring back the social determinants of inequities diagram from CDC and this health equity framework that really looks at the need to address the social determinants, and that these inequities in health outcomes by gender, race, and other factors are really shaped by historical factors as well as current factors that create these inequities. And by virtue of that alone, none of us have magic wands to change this stuff. So we have to work with the folks who have influence in these areas. And similarly, we could use the Connecting the Dots document, norms supporting aggression, harmful gender norms, community violence, lack of economic opportunities. These are all risk factors at the societal level, and I think we have the community. Nope, don't have the community. We just put one slide in there just to remind ourselves, by virtue of the fact that we are trying to influence these broad societal and community factors, we need to engage the partners, the sectors, the leaders, the organizations, to create that broader tent, that bigger movement that can come together to have the kind of influence. So I hope that that's really grounding that, this multi-sector, multi-issue approach, it's not optional. If we want to have impact, it's the way to go. And I see collective impact being mentioned, and that's definitely the spirit. Mm-hmm. There's evidence that it works and it makes a difference. In our study of cities across the U.S., cities with the greatest coordination across these four sectors had the lowest rates of violence affecting youth. That was an evaluation done by the University of California in Los Angeles School of Public Health. So we don't have this data for intimate partner violence or sexual violence, but it's useful that it's been demonstrated on other issues. Mm-hmm. So hopefully that's been some pretty solid grounding for our thinking. And so now let's talk about the challenges and the barriers, because we'd all be doing this and having great impact if it was easy, right? But it's not. It's not. There are lots of challenges and barriers. So what makes it difficult? Let's put it out on the table here. What are the barriers to being able to work in the way that we know is necessary to have the kind of impact that we want to have? So please go ahead and chat your thoughts about that. Unmute yourself and jump in, if you are willing to let us hear your voice.
Oh yeah, Deborah's saying just what I was about to say. Fear. It's for a number of different reasons we can be somewhat afraid either of a lot of things. So I'll let you all share that. But I can definitely echo that, Deborah. It's fear. I don't know what those partners, where they're coming from, what they might want to do. Maybe they had a bad experience in the past. It might not even be the same people, but it's just that sector. And so now I think, I can't work with that sector. Well, I try to have, a more open mind about that stuff now.
Mm-hmm. Funding is being mentioned over and over again, and it's so true. We get these, federal, we get this legislation that designates that funds can be can be used in certain ways, and that we get these grant requirements that sort of put us in a certain direction. I think on the last forum we talked about the linkages to substance abuse, and yet sometimes those grants from our substance abuse partners really sort of require them to work in silos to a certain extent. What else are you seeing, Ashley?
Yeah. Well, I see also a theme here of a lack of understanding, and what it looks like folks are referring to is understanding the different sectors and how they're linked. And I think for me, I have lots of experiences with that, where when I have been successful in doing this kind of intersector work is when I've identified, one person like me in the other sector, I'll just say that for now, who sees those links, and so we're able to then kind of be champions for that and move on from there.
Yeah, yeah. I see lack of common understanding of the intersections of our work, lack of the systems to do our work. I can definitely identify with that. I just feel like everything is in our government, in our funding structures, and even in our organizations are predominantly organized to work one issue at a time, and it takes more effort and more bridge building and more hoop jumping to try to go against those currents and do something differently.
Right, and going against those currents isn't always our job description. So sometimes we're just taking this on ourselves because we feel like it's the right thing to do.
But I think we are seeing more and more grants that require multi-issue, multi-sector collaboration. I would love to see more sexual violence and intimate partner violence folks applying for some of those grants. Perhaps you are. Perhaps we can have another conversation about that. But it is, exciting and promising to see that more funders are, funding this type of work. And I think, our fields and our the folks on this call, I would imagine, are really well positioned to compete for some of that funding. But so let's keep coming back to some of these issues that folks raised, because they are the reality that we face. And what we're going to talk about now is how we can make this work, even given these challenges. So we're going to give some examples. We're going to offer this tool that will hopefully support your work. And please raise these issues, raise these challenges as we go forward, so that it can really be useful to what you are trying to accomplish. But before we do that, a couple of summary. I'm just going to scan really quickly to see if there's anything that, these are, on lack of clarity, we talked about that. Lack of accountability and leadership, that's kind of perhaps a function of some of the way that these systems are set up. Power dynamics, lack of shared ownership. I think turf was mentioned. These are all really good to keep in mind. Here's another quote. Coming together across many government sectors, we have different vocabularies, theoretical frameworks, and worldviews, and we have to find a common language to get work done together. And I think that was mentioned by several folks. So we want to introduce the Collaboration Multiplier tool, which helps to get at some of what Noelle Wiggins is talking about in this quote, the different vocabularies, frameworks, worldviews, etc., and how to build a shared understanding and a shared analysis. So this is our Collaboration Multiplier tool that we introduced really briefly at the end of last forum. And one of the things that I really like and seems to resonate really well with folks doing collaborative work is that Collaboration Multiplier really helps to ensure that the strategies arrive at win-win, because every partner has a different what's in it for me that needs to be discovered. And Collaboration Multiplier is a good tool because it stops to ask and answer those questions. I know I have been guilty of wanting to do multi-sector work that really just benefits my issue. It's like, let's all come together around the table to advance my issue and, what I'm really focused on, and whatever you're focused on really is an afterthought. So Collaboration Multiplier, hopefully is a structure to thinking about multi-sector and multi-issue collaboration that can address some of the potential pitfalls. So the tool is actually pretty straightforward in the sense that it's, there are not a lot of strict rules about how it needs to be used. It's kind of a way of thinking and a way of approaching collaboration, and there are many different ways that it can be used. But at its basic, it helps to delineate similarities, differences, and resources. Through that, it can promote understanding and foster shared vision, goals, and language. It can identify collective strengths as well as missing expertise to ultimately get to joint outcomes and strategies with more clarity for each partner. NSVRC did a great report a couple of years ago called Innovations in Prevention, and it talked about different levels or scales of collaboration, from one that's sort of serving each other's needs, another meaningful coordination, and then up to active collaboration. And they also talked about what that might look like for different partners, whether they're collaborating partners, supporting partners, or emerging partners. But I think Collaboration Multiplier can help to deepen the ways that we are collaborating to get to those joint outcomes and to really maximize the potential and the impact of our work. So that's kind of its purposes, and we're going to demonstrate a couple different ways that it can be used in the next hour. So there are two phases to the tool. The first is gathering all the information that you need and compiling it. And the second is using that information to conduct an analysis and to draw out some implications for your work. So quickly, an example from Houston. This is the example that's written up in our multi-sector guide. I think it's like a 200-page resource document or a reference document that describes this example in detail, and also is just chock full of information about potential sectors that you might want to collaborate with. Lots of worksheets to help you think through each step of the process. In Houston, the 4 sectors that were brought together were public health, public works, youth-serving organizations, and they also engaged property owners and managers. And so the first step around information gathering, they created a list of types of information that they would want to know about these different sectors. And we've seen groups play with this list, add to it, delete things. Sometimes people really want to know the history of the person who's been working in the community and the relationship. So they want to know more about the organization and their orientation and how they're organized. So there's different types of information that you might want to collect, and you can identify that at the beginning. And then you go and you collect it, and you do this in a relationship building way. So you sit down with folks, you talk to folks, you read stuff, and you get, it's fun. It's learning about people in your community and systems in your community, and then compiling it all into a grid. And then the next phase is the analysis phase, and this is where you take all of that information and you kind of move it around and play with it to draw out insights and implications from it. So in this case, we've color-coded the different sectors, and through looking at the information that we collected about each of them, what in this case they really drew out was, what are some shared outcomes that you could work on together? How could how could each partner be contributing their strengths towards those outcomes, and what would the strategies look like if the sectors were all contributing in different ways to achieving those shared outcomes? So in terms of shared outcomes, they dreamed, they visioned, they imagined together what could be achieved together, and they came up with the desire to work together to create a safe, open space near the school that promotes attendance at school and reduces fear of violence among youth. And this really, they felt, that would be a great contribution to changing the environment and changing the factors that were affecting all 4 sectors in different ways. In terms of collective strengths, they identified that they all had data sets that when combined, really told a much clearer and richer picture and story. They had more expertise. They had the expertise to create an attractive space. They had access to the properties that they wanted to help improve. And they had more staffing and volunteers because they were drawing on these 4 sectors. So then they figured out, okay, how are we going to do this? Who has what to bring, and how can we combine those strengths together? So they identified that the youth development and public health could engage young people to conduct a survey of youth and to identify the areas where they wanted to see improvement. And then they realized that the property owners and public works could come together to engage tenants in the buildings and civic organizations to maintain the land and discourage illegal dumping and drug dealing, and that's where they could have influence and contribute. And that the property owners, public works, and the youth together could create a joint use agreement or shared use agreement where they were all working together to remove trash and clear toxins and improve the open spaces. So here's a picture of some of the work that was being done.
Lisa?
Yeah.
Yes. You know what? I'm just hearing background noise, so I'm going to go ahead and mute all lines, and then you can all unmute yourselves by pressing *6. So it'll just be a few seconds.
All guests have been muted. You can unmute your line by pressing *6.
Okay, great. So you can all press *6 to unmute your lines. We encourage you to do so. Just had to get some of that background noise to go away. So apologies for the interruption, Lisa. Oh, and Lisa, I'm not hearing you, so you probably have to press *6.
Great. Sorry, we just had to figure out how to do that.
We all understand.
Okay. Sure. Another joint strategy where they all came together was to make microgrants available to support young people in leading neighborhood cleanup projects and other community-based campaigns. So this was kind of the next level of how this effort to create safe open spaces built on their collaboration and engaged all 4 sectors to continue the work and carry it on to more projects and more campaigns. So that was a pretty quick overview, but I hope you got the flavor, and this is a real example of multi-sector collaborative work that drew on the strengths and contributions of these 4 sectors in a way that really shifted the way that each of the organizations or the sectors were working and created sustainability so that they wanted to continue to work together because they saw that by working together, they all were achieving the outcomes that they wanted to achieve and having a greater impact than any of them could have if they were doing this work alone. So I find it a pretty inspiring story. Now I want to turn to an intimate partner violence example here from California, and I want to
Lisa?
Yes.
Oh, I'm sorry. Before we do that, I just wanted to know, Deborah does have a question about if you know how much were the micro grants?
I do not know, but I imagine that information might be in the resource guide, or and I think we just shared the link. Yep, we just shared the link, and that's also
great.
something that we'd be happy to follow up and try to answer, but I don't know that off the top of my head.
Okay, thank you.
Yeah, no problem. Thank you, Ashley. So I would like to bring Sarah Foley from California Partnership to End Domestic Violence to join us. She is also at a conference today, but is making herself available. So Sarah, if you could unmute by pressing *6, I would love to chat with you for a minute.
Hi, can you hear me?
Yes. Hi, Sarah. How's it going?
Good. Good. I'm glad to be here today.
Oh, so glad to have you. So if you could just, I just kind of said briefly who you are, but if you could restate so that everybody can hear, just tell us your name, your title, your organization, and the issue that you're working on.
Yeah, my name is Sarah Foley, and I'm the Prevention Project Specialist at the California Partnership to End Domestic Violence. And I am the project coordinator for our Delta Focus project here in California. And I came on about 9 months ago. And so when I'm talking about the collaboration multiplier, this happened a year and a half, 2 years before I came on, but I felt the impact even coming on so much later than when this activity had been done with our leadership team.
Okay. Well, can you tell everyone on the forum how Collaboration Multiplier was used and who it was used and the impact that it had?
Yes. So the Collaboration Multiplier was used at one of our first leadership team meetings, and it was used for our Delta Focus project, which was focused on really promoting healthy school environments. And so we brought together, we kind of broke it out into 4 different sectors. It was the public health group was one of our groups, education systems was one of our groups, youth development, and then the domestic violence and social service organizations were our 4th group that we used this with. And I'm not on the webinar, so I'm assuming what you're looking at is the picture from our meeting. And how we used it at our meeting was these 4 groups broke up and discussed 4 different questions. And the questions that they discussed were, what are your disciplines or your field's core values? What are your desired outcomes? And why is healthy relationship promotion or dating abuse prevention important in your work? And then what organizational goals specifically relate to this issue? So the 4 groups discussed that among themselves and then came together as a larger group. And that's what you're seeing in the picture is them coming together as a larger group and putting this up on a wall to have a larger discussion of where the shared values are, where the overlap in the desired outcomes are. And if you go to the next slide, you can kind of see how we filled it out and what that looked like with our organization and our leadership team. And some of as we analyzed and really came together as the discussion, or they came together to discuss it, they really saw a lot of strengths and shared values, really around that holistic health and well-being of the child was really at the center of a lot, all 4 of these organizations or disciplines concerned. There was a focus on systemic change, a commitment to youth development, the need for building relationships and forming that multidisciplinary collaboration and breaking out of the isolation of the fields in the different organizations. Some strengths that really were identified were some of recognizing the strengths that each field brought to the project and really recognizing how those strengths work together. The public health field really brings up the social ecological model that really helps understanding the change and the complex problems that we really want to see the community and societal level change. TV organizations really brought commitment to the mission to end domestic violence and contributed to the long-term sustainability of the project. Youth development really helped shift the view so that youth voices and youth were at the center of the work. And then the education system is a central system which families, communities, and government agencies come together to support young people. And so with the next slide, that kind of is the analyzing of the collaboration multiplier. So we gathered all that information. We really identified where the shared values are, where the shared strengths are. And then we also identified some gaps and weaknesses on the leadership team and where we should maybe think to reach out to some parent organizations, young people, experts in social and emotional learning. So this tool not only helps create that shared vision and the clear purpose that we were all coming together for, it also really helps define our different roles on the leadership team, and really I think was the basis of a really strong and functional team, because when I came on, like I said, 9 months ago, there was already this basis of understanding with everybody on the leadership team on what the shared vision was and how we can all collectively draw on the strengths of the different disciplines that were at the table. And really, it was only with our shared resources, expertise, and opportunities that we are going to achieve that long-term change in the community and societal change that we're looking for.
Super. Well, I'm really glad that the process, which sounds like it was fairly straightforward and simple, had such a lasting impact on your work together over the years. And Sarah, there's a request if you'd be willing to share these documents because they are completely illegible on these slides. Would that be something you'd be willing to do?
Absolutely. I'd love to share these documents.
Great. Thank you. Well, please feel free to unmute yourself and ask Sarah a question if you'd like, or you can also make a comment or share a question in the text chat as well. But Sarah DaCosta had said these are the exact sectors that she's working with, and they're beginning a new planning phase. So hopefully if you can share those documents, that'll be useful to Sarah. So thank you, Sarah, so much for sharing about your experience. And I think what happened in California and the impact of that is really illustrating one way that collaboration multiplier can be used, which is the way that it was originally designed. So thank you, Sarah. Really appreciate your participation. And now I would like to share another way that collaboration multiplier can be used, and that is for an existing sector, let me try that again, an existing coalition or collaborative who has identified a gap in their coalition to think strategically about how to engage a new sector, but not in the way that I described earlier that I confessed that I had done, not in the, ooh, wouldn't it be great if we could bring business partners along, we want them to do this, this, and this, and this, and this for our cause, but in a way that really takes the time to understand that sector and what it is about and where that win-win is and where those joint strategies can come from, and then approaches the relationship building from that way. And we are doing some consultation work in Hillsborough County in Florida for their Safe and Sound County-wide Violence Prevention Plan. And in this case, the existing collaborative really wanted to engage the business sector as partners. And they had no idea who to approach, how to approach them, where to start. And so they used Collaboration Multiplier as a way, and they used some other tools as well. They used Spectrum of Prevention. They looked at this Prevention Institute resource called What's Good for Health is Good for Business, where we have different examples of business sector engagement across the spectrum of prevention, and did a lot of kind of background research and thinking in order to identify who they wanted to approach, how they wanted to approach them, and how they would then proceed with exploring possible multi-sector strategies that would engage the business sector. So just wanted to share that that is another way that Collaboration Multiplier can be used, and that is how we propose that you use it in the homework that we ask you to complete at the end of the last session. So we asked you to think about a new issue partner or a new sector that you might want to engage to expand your work and your impact, and to think through, in this case, on your own or through referring to our resource guide, what are some of the these information categories for your potential partner or potential partners. So what is their mandate? What kind of strategies and activities do they engage in? What are they working towards? What expertise do they bring, etc. So I would love to have you text chat the sectors that you all, or the issues that you all might have thought about So, at the last forum we talked about sexual health, substance abuse, suicide as some of the issues that folks were working across issue or wanted to work across issue with. Chronic disease was also mentioned, and some folks were doing some research about that. We didn't talk as much about cross-sector issues, but some folks were talking about working on determinants like social cohesion or the built environment, and so you can sort of start to think about what sectors would need to be engaged in order to influence those kinds of factors. So let's see, what are we seeing? Sarah says, I did two. One was an existing partner and the other was a new idea. After-school programming and senior services. Fantastic. I'm glad that you were able to use, thank you for illustrating that, in fact, many collaboratives actually use this tool with their existing partners, and they say, hey, you know what, we've been around for many years now, and we sort of make assumptions about what we're working on and how we're working together. Why don't we go through this process that might seem unnecessary, but see what it can do. And we've heard from groups that it's been really useful to reinvigorate existing partnerships and collaborations. So, okay, we're not hearing from anybody else, but would love if folks want to share the issues that they're thinking about or the sectors that they're thinking about.
Right. And Lisa.
Yeah.
Oh. Yeah, this is Ashley. I was just going to say Jen Grove from National Sexual Violence Resource Center and I are actually here at the same conference. We're surrounded by folks from different campuses across the United States.
Yeah.
And one thing that we kind of realized this morning was, wow, there's a whole kind of campus wellness, we would call it a sector, I think, or maybe a subsector within, the larger campus prevention. I mean, they're talking about drug abuse prevention and all sorts of things here, but it's a sector that seems to be very relevant these days.
Mm-hmm. Great. Thank you for adding that. Let's see. So Cynthia says, I'm increasingly interested in planning departments in communities as it relates to the built-in environment and its ability to impact sexual and domestic violence and other prevention areas. I put up this image of the guide just to, we've said it before, but I'll just say it again, that it's chock full of information about different sectors, so it's a really useful reference. And here's the list of sectors in the guide that for which information is provided. So here I actually wanted to pick your brain based on some thinking that we are doing here at Prevention Institute. We've been doing some brainstorming. We started with this list that is in the guide, and we said, which are the sectors that really influence what we think are the community level determinants? In this case, we did it just looking at intimate partner violence. And these are some of the sectors that we prioritize. The private business sector, but particularly businesses that have large segments of low-wage female employees, like restaurant services and domestic workers, or businesses that cater to large segments of male audience, for example, entertainment, sports. We also thought about the economic sector and the public side of things, workforce development departments, housing and community development departments, those public agencies that are really about supporting the economic life of a community. We've also been thinking about the public land use sector, for example, the planning and zoning department. The faith sector is always a sector that we think about, and I know that there's lots of examples of work on intimate partner violence and sexual violence engaging the faith sector. Healthcare is also a site that many of you worked on, and probably social services as well, especially those that address children and families or mental and behavioral health and housing needs. So my question to all of you, and we posted this a little while ago, so I'm going to ask that it be reposted again. I would love to hear your thoughts. Which of these sectors do you think offers the most potential for engagement and impact for preventing sexual and domestic violence? Like, which sector, when you look at this list, do you say, oh my gosh, it would be so cool to have a multi-sector joint strategy project with with this sector and this sector? Or is the sector that you said you really think, oh, Lisa, what are you thinking? That makes no sense at all. Or I would really caution you from going in that direction. Sarah DaCosta says, I think they all have the potential to impact sexual and domestic violence community determinants. Let's see, Deborah says, so much is dependent on relationships and identifying and taking advantage of windows of opportunity. I like the idea of identifying and engaging because of potential, but it also helps to have someone you know to reach out to, or a shared topic or item to use as a bridge. That's a really good point when you think about, how would you manifest the potential that might sort of theoretically exist. So thank you for those tips.
And, answers might vary. I mean, I think we would expect them to vary based on the community or the state as well.
That's true. That's true. I mean, that's one of the things we definitely learned in this process is that states and communities are organized very differently and resource these things very differently, and different sectors have different influence. Some communities, it's like you just wouldn't believe what the library system is doing and the impact that or Parks and Rec, and some communities that's very different. Those sectors are not as robust, or those departments are not as robust. So thank you for bringing that up. Cynthia says the business sector is underengaged right now, and that she thinks that there's a lot of opportunities there. Let's see.
Yeah, and Benny also echoes that, particularly around low-wage female employees. I think we also have to think about policy implications as well. There are a number of states that have a sub-minimum wage, which does disproportionately impact low-income women of color. So I think it's, all of these differences really matter depending on where we're coming from.
Yeah, so that was where I was going to go next. It's sort of, when you look at these sectors and you think about their potential, what could they potentially impact in terms of societal and community determinants, and what kinds of joint strategies can you think of that maybe 3 or more of these sectors could implement together? I know this is kind of like, you kind of have to like expand your brain. I almost feel like I need to stretch my brain open to think in this way, but what could DV services, public health, education, healthcare, and youth development do together? What could public health, DV, private businesses, and workforce development do together to address what you were talking about just now, Ashley? Or what about DV, public health, housing, and planning and zoning along the lines of the Houston example? Jessica says social cohesion strategies bring many sectors' interests. I'd love to hear you talk more about that, Jessica. I know you all are doing work on social cohesion across sectors in Rhode Island. Actually, in fact, we're going to hear from you in just a minute. Deborah says, backing up to the restaurants, do they have a workplace policy on DV, or what do they do if it happens in the restaurant? Those are great points. Jenny Dills says, DV, public health, housing, and zoning can work together on crime prevention through environmental design programming. Jenny's referring to a specific approach that's been articulated called crime prevention through environmental design, and I think the intimate partner violence and sexual violence expertise that this field brings could contribute a lot to that kind of thinking and programming, so thank you for bringing that up. We're going to be transitioning now to a fishbowl discussion, but just want to see if there's anything else that you want to point out that's coming up in the text chat, Ashley.
Oh. Okay. Sorry, I was just checking to see. I thought I was on mute. That's why I said, oh, if you heard me. Okay. So, well, I'm just seeing a lot of really good examples. I honestly have to say, I just saw, I think it was a news story about the issue with, it was a documentary about, is it Banksy, and kind of the graffiti approach in New York City, and I was thinking, even something like that, and this kind of, the work to kind of clean up our streets, and I'm making a, go get them gesture here, which is kind of what I saw the mayor talking about and using. But I don't know, I just think there's so many examples, and it really does depend on kind of what our cities, communities, and states, have available in terms of capacity, but also are prioritizing. And I do think that there's a place for all of us there.
Yeah, yeah. I want to point out what Patricia Ray's mentioned, because it's something that I've been thinking a lot about too. Patricia says that businesses can address norms along with education and youth development. And I think this came up in our discussion about multi-issue, multi-sector policy initiatives last forum, that, what is the relationship between policies and practices and norms? And how can, which sectors have the greatest potential to impact the kind of norms that we're talking about that, it's sometimes really difficult to create a policy solution around. I mean, so I appreciate that you're bringing up, what is the role, how does the business sector shape norms related to sexual and intimate partner violence and teen dating violence? So that's a really good place to explore as well. So thank you for doing that exploration with me and together. And I think that I know that that's, it really starts to get me excited about, how we can continue to build our work out for greater impact on these factors that we know we are trying to address. And so let's bring some more practitioners and experts and advocates into the conversation for another fishbowl. We're going to talk about, it's great to vision and imagine, Lisa, but let's get real. How do you bridge issues and sectors? What are the real opportunities, challenges, and solutions that folks have dealt with? So let's bring Jessica, Tomei, and oops, my notes are, we had another late-breaking participant, and I think it's Cynthia. I hope I'm not wrong. So if you could all unmute yourselves and go ahead and introduce yourself, your name, title, organization, community, state, and the issue that you're working on. And can I ask Jessica to go ahead and start?
And you might have to press *6, Jessica, to unmute yourself.
Or Tomei, are you on the line?
Can you hear me? This is Jessica.
Hi, yeah. Jessica. Yes, so good to hear you.
Sorry, it took a second.
No problem.
So I'm Jessica Walsh. I work in Newport, Rhode Island at the Women's Resource Center, and we have a multi-sector partnership working on social cohesion and health equity.
Great. And Tomei, have you been able to unmute yourself?
Yeah, this is Tommy Keel from the Colorado Department of Public Health, and it's fine, it looks like Tomei, no worries. Colorado Department of Public Health and Environment, and I manage the Sexual Violence Prevention Program.
Great. And I'm so sorry for my, brain lapse here, but I think, is it Cynthia who's our
It is, yep. Hi, everyone. This is Cynthia Roberts, and I work at the Rhode Island Coalition Against Domestic Violence. The piece that I'll talk about is a health equity project that's in two core cities in our state, in Central Falls and Pawtucket. And we work with Jessica, too. Hey, Jessica.
Hi.
Hi.
Well, this is the part where I get to listen deeply and talk very little. So I'm going to turn it over to you to talk about the sectors you're engaging, the opportunities and challenges and solutions that you are employing to bridge issues and sectors to advance your work. So please go ahead and share your thoughts about those questions.
Sure. So this is Jessica. I guess I'll go ahead and hop in and start. And then I hope other folks will also, Cynthia and Tommy, right?
Tommy, yes.
Yeah. Okay, great. Okay, so our partners on our project currently, we have our local land trust, which is an open space and trails conservation organization, the Arts and Cultural Alliance locally, a bike advocacy organization called Bike Newport, our local makerspace, which is a fabrication lab, We also work with the library and the Housing Authority and the Boys and Girls Club and another local community center, as well as the local documentary film festival is also a partner on the project. So we have folks from really across a bunch of different sectors, although we will still be looking to expand. The business sector is markedly absent, as is the faith community, and we're going to work on that. But in terms of what's been going really well, I actually, when we talk about social cohesion and health equity, almost everyone can see a benefit to an issue that they care about. And so we haven't had a great deal of challenge in terms of getting people to the table. It took a little bit of one-on-one conversation and helping people feel comfortable with each partner needed to understand how they connected to health equity or social cohesion. But it didn't really take, it wasn't that hard. We had histories of working with many of these organizations, but even the ones who were new, we had meetings and they're at the table and really excited. So I feel like we sort of learned a lot about health equity and social cohesion and thought about which partners we wanted, and then just kind of went out and talked to them. And perhaps we were just really lucky, but we've had a really good experience thus far engaging with folks. Our biggest challenge has been finding a shared language because each sector, we actually could be talking about the exact same thing, but we use different language. So we joke that planners, they iterate things, and domestic violence agencies try stuff. So it's a really concrete example of how we just literally use different language and trying to get folks to understand the other folks' language and their priorities, and then to have a shared language so everybody can talk and work together has, for me, felt like one of the single biggest challenges at the beginning of the process. And I'll stop talking now and let somebody else hop in.
So this is Tommy Keel with the Colorado Department of Public Health and Environment. And one specific example that I'm going to give that I think is kind of a unique collaborator that we're trying to work with is the Division of Criminal Justice, and specifically the sex offender program over there. It's been interesting having conversations with folks who are, therapists who are working with sex offenders and really doing the post-vention work and trying to figure out where the commonality is in our work and how we can move forward with prevention work, which is the focus of the Public Health Department. And I think what's interesting about it is that it really does focus our work on the perpetration and making sure that we're targeting risk and protective factors that make sense for the violence prevention piece, and really connecting it with what the sex offender field is seeing as trends and patterns with the folks that they're working with. And so I think, personally I was really nervous to begin working with them because it's just such a different lens on the work compared to what our perspective, which is really, we want to treat everyone as, before they even offend. And so having that perspective versus somebody who is counseling someone who is, a registered sex offender is a very different context. And so we've actually had some really great conversations and have surprisingly, from my perspective, had a lot of common ground and common shared interests. And one of the interesting things that they've talked to us about is, they as a sex offender program can't get into a school. There's no way that any school in the country is going to let a sex offender program get in. And so how can they partner with us and leverage with us to really do this primary prevention work that's going to have long-term outcomes for their work as well? And so it's been kind of interesting.
And I'll jump in. This is Cynthia from Rhode Island. And the project that we're working on is a health equity project with two cities that are side by side, Central Falls and Pawtucket. And this project builds on a previous funding opportunity under the ARA investments that came out of CDC. And the project before was called Healthy Places by Design. So a bunch of the people at the table were on the Healthy Places by Design grant, and that was funding that was used to look at place-based health across sectors. So a lot of the data that was collected during that funding opportunity is being used now for a 4-year health equity project, and some of the major people at the table come from the sort of main entities that you would think would impact social determinants of health. So education, housing, food systems, policy and advocacy, the healthcare industry and employment industry, as well as health promotion and mental health, if I didn't already say that one, and local government, including planning offices in both planning departments in both communities, as well as urban farmers, and that's kind of the main idea. Some of the missing partners at the moment are the faith community and businesses, and that's part of the process right now. Is the collaborative is looking at who's at the table and what do those people bring to the collaborative, and then who's not here and who do we need to reach out to. And this particular grant is looking at chronic disease and how local design, community design solutions can address chronic disease. So some of the types of illnesses that they're looking at is related to diabetes and heart disease and obesity. And some of the people coming around the table are the Rhode Island Coalition Against Domestic Violence is one of the people at the table. The backbone agency, which would be the one, for example, that Jessica's organization is their backbone agency in Newport. The backbone agency for the Central Falls Pawtucket one is LISC, it stands for Local Initiative Support Corporations. So that's a community development group that invests sort of materially in communities around developing housing and businesses in low to moderate income neighborhoods. And they have a track record of doing some really cool, very like neighborhood-oriented health equity type work in the state. So, and then the challenges I think at the moment are going to be to engage the community and kind of bring the people in the collaborative to really partner with the community, because it's a really, it's heavy right now in terms of agencies and university people and public health people, and we're going to be working really hard to make sure that it's a partnership with community people as well.
Great. Thank you for bringing that up. So thank you all for sharing the kind of work that you've done and where you've been finding success and how you're approaching things. I wanted to ask you to now kind of really talk about this notion of achieving the win-win. And when you're, if we're looking from a lens of primary prevention of intimate partner violence and sexual violence, and we're doing this multi-sector work where you found common ground around health equity or social cohesion or other types of broad umbrella frameworks, how do you find the strategy that you are confident where there's that real direct linkage where your objectives are going to be achieved? And is it possible to find that? How do you find that win-win? Have you ever been in a situation where you thought, gosh, this sounds great in some ways, but it's really going to take us a step back in terms of the norms that we're trying to shift, or that sort of a situation where you just thought, gosh, this is not a win-win for us, and then how did you deal with that? So I'm excited to hear that that you found common ground around primary prevention with working with sex offender treatment, or I think there was Deborah talked about, or Beth talked about a local RPE working with juvenile justice and using most clubs, which are a primary prevention approach to working with to young men to look at norms and leadership. so, it's great to know that the common ground can be achieved, but what have been, how have you really teased out this notion of win-win, particularly, and how have you addressed it when it's gotten tricky? So we'd love to hear the three of you speak to those kinds of issues. And please, everyone, feel free to chat your own thoughts about what's being discussed as well.
This is Jessica, and I think for me that it's about, and I hope that I can articulate this really well, but that it's a mindset of win-win, that there always is a win-win, you just have to find it. And one of the pieces for me personally that has been really helpful is to really own and be okay with the fact that I cannot do this on my own, and nor can my agency do it on their own. And so it behooves us to really engage these folks and to work really hard to understand where they're coming from and how do we get to, how do we find the sweet spot that is the win-win. And so in an occasion where maybe something comes up that for domestic violence might feel like we couldn't go along with a strategy because it might be a backslide for us, then we just say that, and we say, so that's a concern for us, and let's talk about it, and let's find a way that we can all feel comfortable. So it goes back to one of the pieces that came up around collaboration and collective impact, is that it takes a really long time. And you have to be committed and able to say, we are going to have faith in the process. And if you really pay a lot of attention to the process and you work on those relationships, and you don't rush something that cannot be rushed, then you find the win-win. And I always tell people that I feel like even when you have a funder saying they need something by XYZ day, you can probably give them something by that day without compromising the process. And that's what I work on. I try to find okay, they need something from me. I can give it to them, but I'm also not willing to compromise the process. And there's usually a lot more flexibility, even when you think of the funder as part of your collaborative, and they too want to see the win-win. So if you have an open and transparent relationship with them on your process, then I actually haven't had trouble helping to get the flexibility that we really need to get to the win-win.
So this is Tommy, and Jessica, I think that was excellent how you framed that. For us in Colorado, what has really been a win-win is the momentum around shared risk and protective factors across multiple sectors. It's a framework that really resonates for people, that they can see themselves in, and it helps people to get out of the silos of their issues. And so for us, that has just been sort of our platform where we are cultivating expertise in that in our local communities so they can talk about it and take it back and connect with other folks. And so for us, that has really been just a really huge win-win.
Yeah. And I think to build on what's been said already, one contextual factor here in Rhode Island, I think that really is helpfully pushing people in the direction of win-win, is the fact that our health department is really doing a lot of strong and excellent quality leadership around health equity, and really setting the stage for people to frame it that way. So it feels like that's the conversation, and we have such a small state, and we all partner with each other over many different things. So it feels like there is a shared culture and language that's being developed across sectors. And I really do give our health department and the Division of Community Health and Community Family Health and Equity a lot of credit for really being strong leaders in that.
That's great. It's really striking me that, if you are in relationship with folks and you're in communication and conversation with them, then you can work concerns out and address them proactively, or sometimes, as they're emerging. So it seems like you've all been able to achieve that in your collaborations. So, in the last forum, I think it was Bob Franklin who talked about differences in language and passions that can be perceived as judgments. I don't know if you've ever had a situation like that where, you know, there was a perception or a misperception that somehow one sector or issue was judging the other. So that's one question I have. Another question I have is, what is it like to be in collaborative efforts where domestic violence and sexual violence are not the leading issues? You know, where you're at the table, you know, hopefully as an equal partner or you know, a key partner, but maybe the leading issue or the overarching frame is not about intimate partner or sexual violence prevention. And what is that like, and how do you navigate that? So that was two different questions, and feel free to address either of them or neither of them.
This is Jessica again. I think I know for me, so when we're talking about social cohesion or health equity, we are talking about domestic violence. So I don't feel, it doesn't bother me, because I think we know that from a primary prevention perspective, if we increase social cohesion, if we increase health equity, domestic violence is going to decrease. So I think it takes a mindset where you really have the long view. But I don't mind not having the issue sort of at the center of the conversation all the time, in terms of always saying the words domestic violence. I always tell folks I can do domestic violence prevention without ever saying the words domestic violence. And in many ways, it's very freeing, because it allows you to think in a really broad way about how do we make this community a healthier and safer place to be. And of course, that includes domestic violence. But our communities, they want to be safe, they want to be healthy and happy, and we want to contribute to that process. And so, you know, it's okay that DV isn't said at every meeting, and I feel okay with it. And I think that even, again, the question that you said about sometimes people say things and there's judgment between sectors. I think a lot of times it goes to skilled facilitation, where something that can come across as judgmental, if it can be reframed by the facilitator, or follow-up questions can be asked that help people in the room understand the underlying thought or the reason or the problem that isn't being addressed for that person. A lot of times what is perceived as judgment can be teased out, and everyone can help understand the problem, but also maybe brainstorm around some solutions. But it really takes, I think that's one of the big pieces that's been an aha moment for me recently, is it takes really skilled facilitation to do this. And I walk out of meetings and I feel like I need a nap, because you've been like managing all of these people for 2 hours. So I think this is the reality. It takes really skilled facilitation.
So this is Tommy again, and the only piece that I guess I would add to what Jessica said is that the thing that excites me about being okay with moving beyond our specific issue of DV and SV is that then we're focusing on the context and really getting to those higher level issues. And I think those conversations are so ripe, and there's so much common interest in those conversations that it makes it easier, because we're focusing on those root causes and root problems.
And this is Cynthia, and I'm the evaluator in Rhode Island. So something that's been helpful to us is to be present in conversations when there's discussion about needs assessment and data collections happening, that whenever we can have questions added to surveys related to IPV, that's really helpful, because then we'll be able to show some kind of change over time. So I think I would echo what the other two people just said about seeing it as a holistic shared risk and protective factors related to primary prevention, and to try whenever possible to make sure that if we're collecting data, to make sure to try and collect some IPV data. That's been helpful to us.
Great. Well, I'm going to ask the three of you to stay on if you don't mind. We are actually going to start towards the wrap-up. But if you can stay, please do. If you need to or prefer to jump off the phone line, go ahead. And that's fine too. But I wanted to, we've got about 10 minutes left to wrap up this series, and I first wanted to do a really quick pitch that there's another upcoming opportunity on July 9th. There we go. To talk more. We have a web conference that my colleague Benita Tsao is facilitating on how can sexual and domestic violence prevention better leverage health, justice, education, and community sectors. So there'll be guests, there'll be presentations, there'll be more discussion that kind of builds on what we've talked about today.
And Lisa, we just opened up, like literally minutes ago, registration for that. So I'm going to go ahead and put the link in the text chat.
Perfect timing. So I want to just share my reflections as we wrap up that we started with exploring 4 bridges that link sexual and domestic violence to population health. And we've continued to use the image of the bridge and phrases like bridging, connecting, holistic, health equity. It didn't come up as much today, but in previous, the first and the second, there was lots of webs and weaving that were some of the phrases and images that came to mind. And, I feel like I've gained so much, in terms of understanding of how sexual and domestic violence really is central to this notion of population health and well-being and community health and well-being. So the first text, and I like this bridge image because it's so beautiful, but you kind of don't know where you're going, and you want to go, but it's like, I wonder what's over there. So I want to ask you all to, the 3 of you who are on the phone and also everyone else by text chat, what is one of your favorite images or quotes that really has, that you've appreciated in our 3-series conversation that really bring to life for you and, get your, heart beating faster and you're feeling jazzed when you think about collaboration and partnership. You can also, share if you have here's an image that Indiana shared in the first web conference around weaving this web of shared risk and protective factors. Annie shared this quote in the first web forum from Audre Lorde, which is a favorite. There is no such thing as a single issue struggle because we do not live single issue lives. One of my favorites from Dr. Martin Luther King Jr. is this quote from a letter from a Birmingham jail in 1963. I am cognizant of the interrelatedness of all communities and states. I cannot sit idly by in Atlanta and not be concerned about what happens in Birmingham. Injustice anywhere is a threat to justice everywhere. We are caught in an inescapable network of mutuality, tied in a single garment of destiny. Whatever affects one directly affects all indirectly. So those are some, that have been shared and one of my favorites. So please go ahead and share yours. And so folks on the phone, is there any image or quote that you would like to share? Or Ashley shared, there are 1,000. You want to read this, Ashley?
Sure. I've used this for years. There are 1,000 hacking at the branches of evil to one who is striking at the roots. So I've used that from the connecting the dots perspective for quite a while now.
Wow. It's very poetic. Anyone else by text chat or by phone like to share any images or quotes or reflections of what's really stood out for you in this series?
Hi, this is Sarah.
Hi, Sarah.
Hello. Sarah of
Yes,
Rhode Island.
Oh, it was so good to hear from you by phone. I was really hoping that you might join by phone today.
I was trying to type my answer into text chat, but I got kicked off of the webinar. So I'm still on the call, but it's trying to reconnect me. So what I was trying to type was that I have this thing taped to my computer. success happens in small steps, and good relationships are built through continued effort. Because it's my way of reminding myself that the little things, whether it's follow-up emails or coming to somebody's event or something, is a big piece of the community building that we do. Because sometimes, especially when my schedule gets packed and I get requests to come to things that partners are having in the community, I have to sometimes have that moment where I remind myself that those are really important moments, even if it's a hot dog roast thing they're having because they have to, a new principal or something. Like it may not feel directly related to the prevention of domestic violence, but I need to remember that those connections in the community are really part of how I do my job effectively. And so I've typed this thing up. I don't think it's a quote. I've had it taped to my computer literally for like 4 years. I think I just wrote it to remind myself. I don't have it in quotes, and I like to quote things, so I probably would have put the marks if I'd gotten it somewhere. I just put it right on my computer to remind me that I need to do those things.
Thank you so much for sharing that, Sarah, and I really appreciate the way that you participated today. I've really enjoyed your text chat, and if I could just ask you to continue with one more question. What, for you, has been your biggest takeaway from this series, and what are you leaving with that has some implication for your work and your next steps?
Well, I have found the collaboration multiplier very interesting. After the last session, I downloaded it, and the short version of the guide, I haven't read the 294-page one, but the just like the couple-page sort of introduction, and I actually sat and went through it with a prevention intern who's working with me this summer. She's actually sitting next to me right now, and we were looking at sort of how we could use this to enhance one of the partnerships we already have, but also, I threw like the senior services in there because it's somebody that we haven't worked with, but I know that the senior services department in the city I work in is a pretty robust program. And it turns out when we were digging around looking for, more information about them, we found out that they actually have a whole program of retired of seniors who volunteer, and one of the things that they listed as something they're willing to do is like working with youth. So I had that moment of like, wait a second, we're working on, you never know where you're going to find these connections, and I honestly would not have been on the website looking at this stuff trying to figure out about that if I hadn't had the worksheet, because especially when you've been doing this work for a while, I think you just kind of get to a point where you think you know what you know. And I've been in the community for about 5.5 years in this position, so I know a lot of people. I walk into any school or any community thing, and it's everybody I know, and it's like, oh, hey. But that moment of like, I didn't even know that they did that. So I think the tool is going to be very interesting, and I'm going to be probably talking more to Cynthia and Jeff, my fellow Rhode Island people, about how I can use this in the planning phase that we're about to undergo. And it is interesting to me that making you sit down and write answers in boxes sometimes makes you realize the things you don't know.
Great. Well, thank you so much for sharing that. That's very exciting, and I wish you all the best in your planning effort and exploring that potential new sector to work with. That's great. So a couple more text chats here. Jessica says there's no power for change greater than a community discovering what it cares about. Margaret Wheatley. Beth says there's a quote about they thought that they could bury us, but they didn't know that we were seeds, which is a Mexican proverb. And, Sarah was just talking about, when you were talking, I sort of had this image of an open door and finding an open door to walk through, and I love the image of seeds and planting these seeds and seeing what might grow. And I know others had talked about in previous web conferences images of gardens. So I hope that you all are, walking away with some inspiration and also some concrete ideas for next steps. And I just deeply want to express my gratitude for this time to be in community and conversation together. And with that, I will turn it back to Ashley.
Well, great. And Lisa, I really would like to express my gratitude for you and for Prevention Institute and for Casey and Alexis and all of the work that you have done on this peer learning forum, which officially concludes as of now. So we will be posting, refer back to the link on PreventConnect to the peer learning forum. We'll be posting all sorts of resources for you there as they are finalized, and of course the recording, the text chat transcript, and all of that. And I just want to thank you all for your participation. We really have this online community, especially in the peer learning forums with our smaller audiences. I hope that you can join us on July 9th. It will be a much larger audience. We really look forward to continuing these discussions and talking about these really essential topics. So thank you so much, everybody. And with that, this officially concludes today's session. Thank you.
Thank you. Bye.